Hi there, my name is Hannah Lascano, and I will be presenting on the self-efficacy among Yakima County agricultural workers during a COVID-19 surge. So a bit of background is that Yakima County, Washington has a high agricultural worker population. Approximately 65% of Yakima's workforce are in the agricultural sector. The inability to lock down during a global pandemic culminates into a lived experience among Yakima County's agricultural workers. Other phenomena such as low decisional autonomy, inability to abide by COVID-19 infection prevention protocols, limited access to preventative strategies, workplace culture, and persistent occupational exposure are prevalent in this population. This study aims to examine the self-efficacy to perform key COVID-19 prevention behaviors among agricultural workers during the Delta surge in Yakima County between September 2021 and November 2021. Specifically, we will examine self-efficacy for COVID-19 disease protocols such as staying home when sick, hand washing hygiene, and use of masks, face coverings, and physical distancing. Study procedures. The study utilized an original online survey of Yakima County residents during the reported period of August 2021 and continued throughout September 2021. It involved those who were ages 18 and older, those who lived within Yakima County zip codes, and were able to complete the survey in both English or Spanish. We included all individuals who reported working in agriculture, farming, or food production industries. Self-efficacy was measured using several survey items related to the respondent's self-reported confidence to be able to abide by the prevention behaviors listed in Table 1, and those are: I feel confident I can stay home when I feel sick. I feel confident I can keep my child or other family member home when they feel sick. I feel confident I can regularly wash my hands or use hand sanitizer when out in public. I feel confident I can use a mask or facial covering when out in public. I feel confident I can keep my physical distance in public or crowded spaces, and I feel confident I can keep myself safe from COVID-19 disease. These statements were added to create a novel composite individual self-efficacy score, which is basically those 6 statements added for each participant. Chi-square tests of proportions will be used to detect differences between the agricultural worker group with a sample size of 89 and non-agricultural worker group with a sample size of 212 to examine how occupational status plays a role in an individual's ability to execute behaviors that may protect them under increased occupational risk of exposure, measured using the composite individual self-efficacy score. The primary test variable for this is will be the composite individual self-efficacy score, and the 6 dichotomous statements will be tested against receiving a positive COVID-19 test. Secondary test variables will also be used for analysis during including educational attainment, employment status, race, and ethnicity. So the hypothesis for this study is agricultural workers in Yakima County the null hypothesis for this study is agricultural workers in Yakima County will not have an association between self-efficacy to abide by COVID-19 prevention protocols and receiving a positive COVID-19 test when compared to non-agricultural workers. Our sample population involves 987 total responses from the Keys to Prevention Wave 3 study. 685 responses were removed because they were either incomplete or duplicates, leaving 89 responses for the agricultural workers and 212 responses for the non-agricultural workers. So our agricultural worker sample consisted of a majority male population of 57.3%, a majority white population of 85.4%, and a majority Hispanic population at about 54.5%. 18% of agricultural workers indicated that they did receive a positive COVID-19 test. 18% also indicated that they did not receive a negative test, and about 64% did not answer this question. So our chi-square analysis of the individual 6 statements, so this is the results, were associated to receiving a positive COVID-19 test yielded non-statistically significant results in agricultural workers. The composite individual self-efficacy score for agricultural workers was also significant when associated with positive COVID-19 test results. The non-agricultural worker composite individual self-efficacy score was associated with self-disclosed COVID-19 test results, yielded a significant association. And they also, agricultural workers did yield significant results when associated with employment status and race. Approximately 36% of agricultural workers in the sample self-disclosed disease status, and again, 64% did not answer this question. So the results suggest no significant association of self-efficacy to abide by COVID-19 infection prevention protocols on receiving a positive COVID-19 test in agricultural workers. Data analysis made it clear that using the tested positive for COVID-19 disease metric was likely not the best measure to correlate with self-efficacy. Given the small sample size of agricultural workers, of the agricultural worker group of about 89, a low response rate has the potential to impact the statistical validity of the chi-square proportions to self-efficacy. Participants were not given an answer or an option of I do not know or I prefer not to answer in the primary study. They only had the answer of yes or no to receive a positive test result. Based on the limited answer choices, it is not clear whether participants declined to answer for fear of self-disclosing disease status, or they were not tested either by choice or by circumstance. There is a possibility that the recruitment techniques of the primary study did not reach the agricultural workers truly at risk for occupational exposures. These results indicate a need for greater representation in occupational health sampling and disease reporting. Thank you.